Assalamu alaikum. My name is Muhammad Hassan Khan, and in today's session, we will talk about the Pakistan's response to COVID 19. Coming towards the introduction, we see that COVID 19 is a new form of virus in the coronavirus family. COVID 19 was first identified in December 2019 in Wuhan, China. It took about 3 months reaching Pakistan, and Pakistan confirmed its first case on 26 February. As Pakistan is already suffering from localized epidemics such as dengue, we can say that this virus could be a nightmare for Pakistan's economy. The Pakistani healthcare condition is not up to the mark. Outbreaks of such scale expose gaps and fractures in the underlying healthcare system. This can be related to a timely detection of disease, availability of basic healthcare, tracing contacts, quarantine and isolation procedures, and preparedness beyond the health sector. Pakistan spends only 2% of its GDP on healthcare against a global average of 10%. It also fares much worse than its neighbors Iran and India in terms of health related indicators. Now, if we analyze the latest data from the World Bank as shown in the figure, we see that Pakistan spends around $40 per citizen on healthcare compared to India's $62 and Iran's $415. It is clear why policymakers in Pakistan are deeply concerned. Some feel that Pakistan focuses on public health occasionally, like when there is some form of emergency situation. Pakistan don't focus on healthcare in normal situation to be ready for such pandemics in future. Therefore, we can say that country lacks health system that can timely detect and treat such large scale outbreaks. Unequal access to healthcare is a problem for everyone, since this disease does not differentiate between the rich and the poor. This disease can be 10 times more deadly for poor because rich have access to many options, like we can say that private healthcare, better education, options to work from home, and access to insurance to lessen the shock of such outbreaks. Social protection consists of policies and programs designed to reduce poverty by promoting efficient labor markets, diminishing people's exposure to risks, and enhancing their capacity to manage economic and social risks such as unemployment, exclusion, sickness, disability, and old age. So, social protection is of great importance during an emergency. Unfortunately, Pakistan's social protection expenditure is just under 2% of GDP, far lower than the global average of 11.6%. And within the most of the informal sector are not covered by this scheme, despite its contribution to GDP and unemployment. The Pakistani equivalent of public distribution systems, the Utility Stores Corporation, is grossly underfunded and likely to plug gaps if food supply chains are disrupted. Pakistani government have many hurdles in its way to deal with COVID-19 in the form of social, political and cultural context of the country. Pakistan is already struggling with less infectious disease like polio because of the resistance that is mainly created by the political instability and damaged economy. It is really important for Pakistan to overcome these obstacles in order to fight this pandemic effectively. One of the top challenge is that within government there are cooperation obstacles that must be overcome. There is a lack of coordination between the federal and provincial governments. Well coordinated governance structures are critical for quick and efficient response to such a crisis, as most of the critical services including health and social protection are now the responsibility of the provinces. Each province is making decisions independently. Moreover, for countries as populated as Pakistan, local governments can play a vital role in reducing disease transmission and resistance to health providers by leveraging local networks. Pakistan also economically suffers a lot due to the already damaged economy. A downturn in Pakistan GDP was observed even before pandemic reached the country. So the condition is very critical. Up to $5 billion economic loss is predicted already. Now coming towards the Pakistan response. The most initial response was the dedication of a package of PKR 1.13 trillion for assistance of poor and needy and protecting industry and businesses. But there still remains a problem of distributing this to the eligible ones. Like many other countries, the government is experimenting with various forms of lockdown, but many experts believe that a complete lockdown is not a solution. Most of the world countries are inclining towards smart lockdown and Pakistan is trying to do the same, which is a better solution. Now, keeping in view the country's healthcare condition, government has set aside PKR 50 billion to purchase medical equipment. The testing capacity have also been increased to 900,000. Pakistan is coming up with innovative smart solutions and exploring the use of technology to create awareness. To promote public knowledge, the government has, in collaboration with the telecommunication industry, replaced ringtones with an awareness message to the caller about the danger of COVID-19 and measures that can be taken to remain safe. The government regularly sends an SMS to encourage people to wash hands and practice social distancing. Authorities are also contacting suspects of confirmed cases through mobile tracking and pushing them to get their test done. In the conclusion, I would say that the challenges remain severe. Such pandemics exposes government's deficiency in response towards poverty, healthcare, social protection, and governance, while this is the time that requires strong government response. Early actions help government to handle such pandemics better because we cannot predict when will the next pandemic hit. Now this is the time to see whether the steps government has taken to improve medical disorder will be enough to get out of this situation. But we should know that Pakistan is facing severe challenges in these crises. Now that brings us to the end. Thank you so much for your interest.